Health Matters. I'm your host, Dr. Lana Marconi. On today's show, we're going to explore various forms of complementary and alternative health care, such as naturopathic medicine and IV treatments. Then we're going to shift into Chinese medicine and how it can actually help stroke patients. And finally, we're going to dive into the world of yoga. We have the ultimate yogini on the show with us. And now, welcome my first guest, naturopathic Dr. Jennifer Lococo. Dr. Jennifer.
Hi, how are you today?
Fantastic. How are you?
Good. Thanks for having me.
No, my pleasure, my pleasure. So, naturopathic medicine, there's always a story behind why, a practitioner becomes what they become. What's your journey into naturopathic medicine?
Definitely. For myself, I actually was interested in finance. That was the route I was going to take in school. And when I was in high school, my mom was always trying to push for me to study health sciences, and I convinced my mother that there was no way I was ever going to be ending up in the field of health science, so I did not need my biology at all. But funny story. So as I was going to university, I started becoming really sick. I had a lot of health issues, a lot of GI issues, a lot of MSK problems, musculoskeletal, et cetera, et cetera. And I was going to the conventional doctor, and I never really went to the conventional doctor before. And the treatment that they were offering was just to refer to a specialist and have some imaging done and take some pharmaceutical drugs, but nothing was really helping me, and I was just kind of deteriorating, and I was really young, and I was never sick before, so I just couldn't accept that this was happening. So I just started researching, and I was very, very ignorant to the world of alternative healthcare, so I had no idea.
But it sounds like you took control of your own health at that point.
Yeah, because I didn't, and that's a thing for a lot of patients, and that I can, I guess, really understand and have some empathy towards, because when you're in that position and conventional medicine is telling you that this is the only thing that we can do for you, if you choose to accept it, then you're going to live a very sad life, right? And your quality of life is going to diminish drastically. So for myself, I was in school and I had all these dreams and aspirations of what I wanted to accomplish. So I was like, there's no way I'm letting this interfere with my life plan.
Good for you.
And so then I learned about the field of alternative health, and I fell in love with it, and it helped me. And here I am today.
Wonderful. So what does a naturopathic doctor do? What's the scope of practice?
So the difference between a naturopathic doctor and a conventional medical doctor is the way we treat. Mm-hmm. So we are actually going to be moving towards prescribing rights soon with naturopathic doctors, but that being said, and prescribing rights are for more pharmaceutical drugs.
Right. But so you are under the Drugless Protection Act.
Currently.
But that's changing.
Yes, we are moving towards the regulated healthcare professional, and under that regulation, we are promised thus far that we will have some prescription rates. In British Columbia, the naturopathic doctors there have already achieved the prescription rate.
So do you want that prescription rate?
Yeah, it's a really good question, because there's a lot of battle between the fields of ourselves. There's a lot of naturopathic doctors who are very against and a lot of for, and the reason for that is because we're afraid that we're going to turn into more of a medical, conventional medical doctor. Mm-hmm. So with naturopathic medicine, we're using all alternative health care options to treat the patient, and not just to treat the patient's symptoms, but trying to cure the underlying cause of their disease. So we use acupuncture, traditional Chinese medicine, nutrition, botanical medicine, physical medicine, hydrotherapy, counseling. Mm-hmm. The list just kind of goes on. It's just kind of got like a conglomerate of different things.
Sure.
And then each naturopath kind of finds the area that they're interested in and focuses in on that area.
So interestingly, on the Canadian College of Naturopathic Medicine, it said that a new survey commissioned by the Canadian College of Naturopathic Medicine, is this your college? Mm-hmm. Okay, so this is what your college says, reveals that almost half of all people in Ontario treated by naturopathic doctors report naturopathic medicine has helped reduce their use of prescription drugs. Yeah. That's very cool, hands down. Why would you want to now prescribe prescription drugs? That would be my question.
I know. It's a very good point.
We need to get people off the drugs.
You're absolutely right. And I think that it's more of a situation where maybe it's because we act, not all the time, but a lot of the time, even for my patients, and I know my colleagues' patients, as their primary healthcare professional. So when you're their primary healthcare professional, they're coming to see you before they're going to see their medical doctor. And in case, or if there's that emergent need for antibiotics, to have to go through the hoopla of going to book the appointment with their medical doctor, it's the time frame. This gets taken care of much earlier, and it's the cost on the healthcare system is reduced drastically. So I think that that's the where Health Canada is coming from as well, of why they would be okay with it. But for our field on our own, Do we want to be prescribing pharmaceutical drugs for every condition out there? Absolutely not. There are some conditions that pharmaceutical drugs do play an important role in. It's a very limited amount, but there are some where we need them, yes.
So just for folks at home, prescription medications are the 4th leading cause of death in Canada and the United States, according to the Journal of the American Medical Association. Cancer actually is the 1st leading cause of death here in Canada by 30%. Now, you do IV treatments to help people with cancer. Yes. I want to know all about that.
Yeah. So intravenous vitamin therapy, we are combining all of these minerals and vitamins and antioxidants and amino acids, and we are compounding an IV specific to the patient's needs. So we treat anywhere from just a preventative standpoint for someone, maybe they're a little fatigued, or maybe they're, when we look at their blood results, we're like, okay, you're just a little deficient here and there. This is going to bring you up to optimal health. Or we treat all the way to cancer, so even stage 4 cancer. When we get into the oncology aspect of intravenous vitamin therapy, we're dealing with intravenous vitamin C. So high-dose vitamin C therapy has been proven to reduce the side effects of chemotherapy and radiation, and it's also been shown to be almost like a natural chemotherapeutic agent, because vitamin C at high doses acts as a pro-oxidant, and when you're doing chemotherapy, that's what you're doing. You're trying to act as a pro-oxidant, meaning you want to cause damage to the cancer cells. So that's what a pro-oxidant is, as opposed to an antioxidant, which would support the health of the cell. But to get to that high dose of vitamin C, orally we could never consume that much vitamin C. And the reason for that is because once we get to a certain dose of vitamin C, and on average I would say it's between maybe 3,000, 5,000 milligrams per person, to take that amount at once will cause osmotic diarrhea. So you're not absorbing it, and now you're having an imbalance in the gut. So when we do IV, we're going up to 25 grams we start out for cancer, and we go all the way up to 100 grams, so 100,000 milligrams. So 25,000 milligrams to 100,000 milligrams. You could never possibly take that amount by mouth.
What about just the IV of vitamin C alone without the chemo?
So we do have patients that choose that route, and there has been a lot of studies performed that show the efficacy of this treatment as a standalone therapy for cancer. That being said, it's an individualized decision of what the patient chooses to do. So we just try to inform the patient as much as possible, and it's their choice at the end of the day which method they choose to go with.
I'm happy to hear that, because I love documentaries. And one of the documentaries that I watched was Dying to Have Known, and it's about the Gerson Therapy, which is all plant-based therapy. And they've cured hundreds and thousands of people on a plant-based diet alone. And what was really interesting watching this documentary is that the people who went through the chemo, they had so much pain and misery going through it, and they started to turn towards this plant-based medicine, the Gerson Therapy, and their own doctors were objecting to it, saying, don't do it, it's suicide, what are you doing, you're crazy to do this. And these patients were like, oh, well, I have to, you're not giving me any other option, you're sending me home to die. So they would go to do this plant-based diet and the coffee, enemas, and they were cured of cancer. The MRI showed the cancers were gone, and still their doctors would not believe it. This documentary is incredible. So some of the doctors would say, well, they didn't have cancer in the first place.
Exactly.
Right? Or cancer goes away on its own. Like blatantly lying that, this doesn't work, this type of a treatment, on a plant-based diet. And what was really cool is the filmmaker actually interviewed Dr. Campbell, and he was responsible for doing the China study that showed that eating too much animal protein can turn it on and off the cancer gene in us. And so the filmmaker asked him, if you had cancer, what would your choice of treatment be? He said, plants, plant-based, all the way, no chemotherapy. So Dr. Jennifer, if you had cancer, God forbid that would happen to you, but it's a straight up question. If you had cancer, what would your choice of treatment be?
I would avoid seeing the side effects of the chemotherapy and the radiation in my patients. The side effects so maybe you're considered a cancer survivor, and a cancer survivor is considered a cancer survivor if you have passed 5 years since you've been diagnosed. So you could die the day after 5 years, but now you've been deemed a cancer survivor, and therefore that means that the chemotherapy and the radiation has worked for you. My patients aren't dying from the from the cancer. They're dying from the side effects of the chemotherapy and the radiation. And now your quality of life is diminished. So I've read cases and situations where patients have been able to deal with it without the chemotherapy and radiation. That being said, I'm not saying that there's not a place or a time, but if you are going to go down that route and do chemotherapy or do radiation, you better be doing alternative healthcare alongside, because you need to be avoiding the side effects of that chemotherapy and radiation, and you need to be supporting your system through that very, very, very drastic, dangerous, toxic poison that you're putting and exposing your body to.
Yeah, another great documentary was Dr. Bernstein, Cancer is Serious Business. I don't know if you've ever seen it, but this is how it opens up. A sheriff, it was this commission, they're in a courthouse, and it's in California, and the sheriff, his 7-year-old daughter had cancer, and basically he's testifying to the judge saying, she had cancer, we took her to my medical doctor. My medical doctor said, well, you know what, take her home to die, because she's going to die anyways, or we can do chemo. And the sheriff had no knowledge, because nobody has any knowledge unless you research this, right? Yeah. So he trusted the medical doctor and went there, and the 7-year-old girl, she had brain cancer, and the chemo, second-degree burns on her head, burnt all her hair. Her urine was so toxic that the parents had to wear gloves, and it burned the girl every time she, urinated. It was horrendous. It was horrendous. And still after that, the doctor said, well, we've done all we can. She's going to die anyways, so after we've tortured her, basically, go home. So the sheriff was like, I have to do something here as a parent and protect my child. So he came across Dr. Bernstein. He lives in Texas. He has this $25 million laboratory where he does anti-neoplasms. Okay, so basically he takes peptides from healthy people, puts them in people who are cancerous. And I'm, belittling the sophistication of what this man does, right? He's been on Oprah, Dr. Oz. His battle with the FDA has been legendary, right? And his daughter lived. The tumors and cancer were gone for about, I can't remember, like 18 months or something like that. And then after the family took her off the anti-neoplastins, the tumor came back. So they went back on the anti-neoplastins. Tumor went away again, nothing there. But then the child died because of the chemo and radiation before that had destroyed her brain, and her brain fell apart. And it was neurological necrosis that the child had died. And it wasn't because it was a tumor that the autopsy showed. So this man, Dr. Bernstein, you got to watch it. I mean, cancer is serious business. It's all about profit, and it's all about how the medical industry is totally bought, and every published paper out there is an advertisement for the drug industry, and it's not for natural medicine. And it's just insane.
And there's so many documentaries that show and there's a list of them. There's Food Matters. There's another one, I can't remember the name, but there's so many that show the horror and the how these medical doctors that were maybe pursuing natural methods would lose their license, and how the pharmaceutical industry would go after them. It's really sad. It's really sad, and how uneducated the conventional medical system is in regards to cancer. I don't understand how there's so many cancer foundations and there's so many charities. What are you raising money for? You're not raising money for anything. You want to raise money for something, raise money for alternative natural treatment, because that's what they're doing. If you look at what's happening in the world. So if we look at one of the therapies that we also offer too is mistletoe therapy, so mistletoe injection. This is standard treatment in Germany. So anyone, if you're diagnosed with cancer in Germany, you're getting mistletoe injections, which is to stimulate the immune system to fight the cancer, okay? They're doing alternative therapy alongside conventional, okay? So, they're combining the best knowledge of both. But also in Germany, if you are diagnosed with cancer, you're going to a spa up in the mountain, you're in fresh air, you're eating great food, like you're doing hydrotherapy, you're getting the best of both worlds. And that's what I really hope that our medical system can work towards.
That's what we need. I'm just going to cut you off right there because we need to take a break. Great conversation. I'm so glad you're here today to participate in this. We'll be back more with Dr. Jennifer Lococo, and we're going to do an IV demonstration. Come on back. Did you know that yoga can improve your health substantially? For example, it can improve your flexibility, build muscle strength, perfect your posture, and reduce mental and emotional stress. What are you waiting for? Get your mat and enjoy doing yoga today. Welcome back to Health Matters. I'm joined by the lovely Dr. Jennifer Lococo. She's a naturopathic doctor, and now she's going to demonstrate an IV treatment on her model, Katrina. Welcome, Katrina.
Thank you.
So what are we injecting?
Okay, so today we're going to be injecting some vitamin C, some magnesium, calcium, some antioxidants like N-acetylcysteine, some multi-minerals, all your lovely B vitamins that help with stress and mood and energy. And that's what's in the IV today.
That's what's in the IV.
And everybody, sorry.
Yeah, no, go ahead.
Oh, I was going to say that all the patients, pump. So all the patients, like every IV is different because every IV is meant for a different purpose.
And have you had this before, Katrina?
I have,
Mm-hmm.
yes.
And how does it feel?
It's actually painless.
Mm-hmm. And have you noticed a change in your mood, energy, behavior?
Definitely an increase in mood.